You are listening to the Vet Podcast, presented by veterinarian Dr. Brian Greger from New Zealand. Join us as we discuss pet health issues from around the world.
Making headlines in the UK at the moment are recent amendments to the Dangerous Dogs Act. Vet Charlotte Farr talks us through this minefield. It may seem like microsurgery, but there are some big benefits in getting your rat neutered, Richard Grubb explains. And finally, there is an increasing trend for non-veterinarians undertaking what is referred to as Anesthetic Free Dentistry. From Ontario, Canada, vet Scott Arnold discusses this procedure. There have been some major changes in the Dangerous Dogs Act in the UK recently. Vet Charlotte Farr delves into the implications of these changes. Charlotte, first of all, where do these changes apply to?
So our Dangerous Dogs Act was amended in May this year, and it applies to the whole of England and Wales.
Now, what's prompted the changes?
The changes were prompted because there's been many high-profile dog attacks in the UK over the past couple of years, a lot of these involving children, where children have unfortunately been killed, and a lot of these cases have actually been to do with family pets.
So what has been changed in the Act?
There are three main changes in the Act. The most important one is that the Act now covers any incident on private property as well as in public spaces. So this means it includes attacks in your own house and garden involving your own pet and your own family. It's also now an offence for your dog to attack an assistance dog, so a guide dog or a hearing dog, and these attacks now carry a 3-year prison sentence. However, attacks on other dogs are currently not a criminal offence. There's also been a change to allow police and local authorities to seize dangerously out of control dogs in your home as well as if they're out in public.
What are the implications of these changes to the normal dog owner?
Well, these changes mean that dog owners now need to be even more careful, and it's important to realise that this Act applies to every dog, whether it's a large breed or a tiny toy breed. And the Act also doesn't take into account if your dog is actually out of control. Someone just has to feel threatened or afraid by your dog for it to be deemed dangerously out of control. So for some animals who are normally very docile, a happy dog sort of bounding over to somebody could be seen as threatening, and that's what owners have to be really careful about. And you could be fined now up to £5,000 or given a 6-month prison sentence if your dog's deemed as being dangerously out of control. Dog owners, therefore, now need to be really careful with unexpected visitors coming onto their property, so delivery workers, postal workers who might walk up to your house, and also children that might lose toys over walls and fences into your garden and be tempted to enter. Visitors now need to be able to reach the front door of your house without encountering your dog. So this means you can no longer leave it loose in the front of your house, even if the front garden is all fenced in. And there's a big grey area with if this unexpected visitor is actually someone who has criminal intent, so a burglar. If the burglar's inside your own home, then you won't be prosecuted if your dog attacks them. But the grey area occurs if this happens outside in the grounds of your property. And the general rule is that it depends on the individual case.
So what happens if somebody comes and knocks on your door, if your friend, if a encyclopedia salesman or someone comes and knocks at your door and the dog is inside your house?
You need to start taking basic control measures from now on, basically. So if someone knocks at your door, rings the doorbell, before you actually go to the door, you need to make sure that your dog is ideally confined to a different room. And if your dog is going to become aggressive or start tearing your house apart, if you shut them in a different room away from you while you go to the door, then you need to consult a behaviourist to help you out, because you can't let your dog any longer come with you to the front door.
So you've got your dog confined, as far as you're concerned, legally in your contained area. The gates are closed, the dog can't get out. The kids next door kick a ball over the fence and they want to come and get it. What advice would you give in this sort of situation?
It's really important that people with dogs discuss with their neighbours, especially those with children, about what they do in those situations. And we're encouraging people to give neighbours their contact numbers so that if they should need to enter your property for any justified reason like this, they can call you and check that it's safe and appropriate for them to enter and retrieve a lost toy, for example. And we're also encouraging parents to speak to their children regarding this and about safety around dogs, to make sure they don't just enter gardens where a dog might be out there not under adult supervision and control.
Is it potentially possible for a dog to be not under control when it's being walked on a lead?
If what being walked on a lead, it's basically taking common sense measures really, and keeping your dog away from small children. And again, this is about educating children as well, encouraging them not to actually go up to a dog they don't know and say hello to it and put their face close to its mouth without checking that it's okay.
So just in a nutshell then, Charlotte, what measures should dog owners be taking to make sure that they don't come on the wrong side of these changes?
Most of the measures that people would need to take to make sure that they don't contradict this act are basic responsible dog ownership measures really. So always walking your pet on the lead, and before letting off the lead, just consider where you are and who's around. And if your dog can be aggressive, snappy, unpredictable, or has ever displayed any sort of aggressive behaviour in the past, then always use a muzzle when in a public place. Just don't take any chances anymore. And getting your dog to actually understand basic training commands as well will really help when you're out walking.
Has there been much in the way of a public education program instigated with this act coming into place?
There's not really, to be honest. There hasn't been any sort of public education. There's a lot of discussion about this act all over the press over here at the moment. It's all over the TV and the papers, but it's basically talking about the changes in the act and lots of people's opinions about it, rather than actually trying to educate people and children about how to act around dogs and what to do. There has been a bit of a movement over here to start using coloured ribbons on dogs' leads or collars when you're out walking them, and basically different colours indicate whether a dog is actually safe to approach or whether you need to stay clear. But what the colours mean isn't actually widely known. So unless you actually are fully aware of the scheme and you've been online and researched it, you don't actually know what the particular colour ribbon actually corresponds to.
Now, these amendments have been in place since May this year. I suppose there have been a few test cases go through.
At the moment, there hasn't been anything made public about any of these changes actually causing any problems. I think that it's started to come in quite slowly, really, and people aren't quite sure actually what to do with it, because there's a bit of a grey area over when a dog is deemed dangerous. And as I said before, some people can be afraid of a dog coming bounding over to them. So I think at the moment it's going to take a bit of time for this to actually be put into practice, even though it's actually come through.
If you were in the UK, how have these amendments affected you? Have you made any changes to how you handle your dog or what you do with it? Love to have you post your comments on our Facebook page. Just search for The Space Vet Podcast, or you can email us at vetpodcast@gmail.com. Now, staying in the UK, there is growing evidence for the health advantages of neutering rats. Richard Grubb tackles this microscopic issue. Richard, first up, why do we neuter rats?
The main reasons really would be to prevent breeding, if you're aiming to try and keep mixed groups together, reduce the risk of fighting in males particularly, and decrease reproductive disease, females, of which there's a couple, particularly mammary tumours, which develop much more commonly in unneutered rats, very, very common. And certain types of rats can develop tumours in the pituitary gland in the brain as they get older, and the risk of that has been found to be reduced by neutering as well.
Now, these are obviously fairly small animals. How technically difficult is it to spay or to neuter them?
Well, surprisingly, actually, it's quite simple. It's not particularly more difficult than really doing a cat or a ferret, really. The small size does play a part, and magnification is often useful, but the actual procedure itself is actually quite straightforward.
So what kind of age are you doing them?
Generally before the age of 4 months is recommended. Most of the studies that have been done show that the greatest sort of benefit on reducing the risk of disease.
Now, with being such small animals, there's got to be risks involved. What are they, and how do you mitigate, how do you avoid them?
I think the biggest risks associated with small rodent anaesthesia, really, one of the biggest risks is hypothermia, or getting too cold. They're small animals, they lose heat pretty quickly. That can be mitigated by just putting them on a warm heat pad, making sure you monitor the temperature during the anaesthetic, covering any extremities with things like bubble wrap, and trying to keep the hair clip down to a minimum. Those things can help. Blood loss is a bit of a concern as well. although they can lose more blood than you perhaps think. But again, using fluids pre-operatively is never a bad idea, and it does help to reduce some of the risk.
Do you consider then that the benefits of neutering, desexing rats outweigh the risks?
I think when done at a reasonably young age, I think they do. Rats in general actually tolerate anaesthesia quite well, particularly when they're young. When they're older and there are other subclinical problems like respiratory disease and other issues there are some more risks. But I think when they're young and those things haven't had time to develop yet, I think the risk is actually reasonably low.
What about other small pets, things like guinea pigs? Are you looking at desexing them as well?
Desexing guinea pigs is technically possible. It's performed in a sort of similar way to the rat, and there are some benefits in terms of reducing the risk of cysts on the ovaries, which are very common in guinea pigs and a couple of other small mammals. The thing with guinea pigs particularly is they don't tolerate abdominal surgery as well as rats and things. And I think the risk after surgery with them is perhaps a little bit higher of complications. So there are benefits, but I think the risks, as I say, are a bit higher. So perhaps it's not as well tolerated.
And finally, there is an increasing trend for non-veterinarians undertaking what is referred to as Anesthetic Free Dentistry. From Ontario, Canada, Vet Scott Arnold discusses this procedure.
Today I had a dog owner in my clinic who was asking me why dental cleaning at the vets costs so much more when she get the same service at the local pet store for a fraction of the cost. What the owner was referring to was non-professional dental scaling, also known as anesthesia free dentistry. This service is gaining popularity with dog and cat owners. The main factors driving this popularity is the lower cost and the perceived risk of general anesthesia. These are well-meaning pet owners who may be fearful of anesthesia or may not be able to afford professional veterinary dental care. You may wonder, why is anesthesia necessary for dental procedures? Number 1, it allows for a thorough exam of the oral cavity. Number 2, it immobilizes the patient, allowing for good quality dental x-rays. Number 3, it allows for scaling below the gum line where periodontal disease is most active. As well, it allows for pain management. Veterinary practice that routinely perform dentals are practiced at an advanced level of care. They're also most likely to be well equipped to safely monitor your patients and to handle any problems they encounter. I must remind pet owners, only licensed veterinarians can practice veterinary medicine. If you have any concerns at all about your pet's dental health, please consult your veterinarian. He or she is the one who has been best trained to provide you with the best advice for your pet's dental care.
What are your thoughts on anesthetic-free dentals? Have you had experience with it? Why not jump onto our Facebook page? Again, just search Facebook for The Space Vet Podcast, and we would love to hear what you have to say about this.
You have been listening to the Vet Podcast. You can find us on Facebook, iTunes, Google Play, or bookmark us in your favourite podcast player. To contact us, message through Facebook or email vetpodcast@gmail.com.